My name's Meg Linton. I'm still the mostly new CEO of the Newport Beach Public Library Foundation, and I'm really thrilled that you're all here today. This is a very popular topic and has been in the news a lot lately. And I just wanted to ask, before I do introductions and so forth, how many of you are foundation members? Oh, thank you. This is really wonderful. Your foundation membership helps make these programs happen, along with our partnership with UCI Health and our funders of this specific program, Mike and Polly Smith. So if you could give Mike and Polly Smith a round of applause, that would be wonderful. And I also wanted to make sure that you get, if you haven't gotten one already, this is our new brochure that lists the entire Medicine in Our Backyard series for the next, well, there's a total of 8 lectures. So there's one a month over the next few months. So hopefully you'll pick one of those up, and also we have all of our information available online on our website as well. So that's that. And then we also just published our brand new bookmark magazine, which tells you about what's coming up with our Library Live series and our Witty Lecture series, which is our Distinguished Lecture series. So there's lots of really, really great events coming up, and I hope you'll pick one up and hopefully enjoy reading it. So tonight, Dr. Brent Yeung is here. He's Assistant Clinical Professor for UCI Health in the Department of Anesthesiology and Perioperative Care. And he's going to discuss the use of cannabis for pain, fact, fiction, and everything in between. Cannabis is being touted as a panacea for just about anything that ails you. Claims have been made that it lowers blood sugar, slows Alzheimer's disease, and alleviates a wide range of psychological problems, from anxiety and depression to PTSD and psychosis. But few studies have been done on cannabis, and that's why Dr. Yeung is here to tell us all about it. A little background on Dr. Yeung. He is a UCI Health anesthesiologist who specializes in the management and treatment of pain. His clinical interests include interventional procedures for chronic pain, pain management, and the use of cannabis in relieving pain. Yeung's research interests involve developing new methods to measure and treat pain, including discovering pain biomarkers, determining cannabis's effectiveness in adjuvant pain relief, and identifying biomarkers for intoxication. He provides hands-on, practical instruction to medical students, residents, and fellows. He earned his medical degree at Georgetown University School of Medicine in Washington, D.C. He interned in general surgery at MedStar Washington Hospital Center and completed a residency in anesthesiology at MedStar Georgetown University Hospital. We are fortunate to have Dr. Yeung in OC, and I found out that he grew up here too. And so he's a local boy who's come home. He is passionate about his roles as a physician, teacher, and researcher. He sees his patients and in the perioperative and outpatient settings at UC Irvine Medical Center in Orange and at UCI Health in Yorba Linda Specialty. So please welcome Dr. Yeung.
Well, thank you very much for having me tonight. It's really a great it's really a great honor for me to be speaking in front of you tonight. I remember when this library first opened in the 90s, and I had been going to the Corona del Mar branch, and I started coming here and studying, and every meaningful test that I have ever studied for, I studied for here. And it got me into UC Berkeley, it got me into Georgetown, and also got me in a fellowship here at UC Irvine. So I owe a lot to this library and the wonderful facility that it is. So tonight, I think all of you are interested in cannabis. I really like this title that I stole from the library the publicity for this talk, fact, fiction, and everything in between, because there is very little fact on the clinical implication of cannabis. There is even more fiction, and on top of that, even more of the everything in between. But hopefully I can clear some of the questions that you have up and maybe provoke more questions. So I have no disclosures. There are no cannabis industries that are funding me, and I have no investments in any cannabis industries for or against the use of cannabis. So as I was doing the research for this lecture, I just wanted to look up all the images and publicity that's out there. This is all found on Google. So on the left, there's a billboard that says, Child Poison Center calls increased 5 times after marijuana legalization in one of the states that legalized cannabis. So that makes me not really think that cannabis is a very good thing. But on the right, there's another billboard that says, since legalizing marijuana in 2012, Colorado has no increase in youth marijuana usage, and neither has Washington. So clearly there's this discrepancy of, what is really the fact behind these billboards. This is another advertisement for and against cannabis. I know it's a little bit hard to read, but so I'll read it out for you. On the top left, it says, regular marijuana use can cause depression, anxiety, and bipolar disorder in both adolescents and adults. A breastfeeding baby can absorb as much as 8 times more THC than its mother. Using marijuana under the age of 25 can cause long-lasting damage to the brain, and smoking marijuana creates the same toxins and cancer-causing chemicals as smoking cigarettes. And I like in this on the left, it all says it can, so that means that it also cannot do those things as well. On the right, there's another billboard that says beer, wine, and safer. So that gives us this sense of security that says that cannabis is safer than drinking beer or wine. And I don't know of the studies that prove that. So the objectives of this talk, I do want to give you just a small, brief history of the cannabis and the history and the historical basis of using cannabis. Some of the red tape around its use and why it's not really widely or hasn't been widely used up until very recently. It is important to understand what the system in our bodies, what cannabis is affecting, and that's mainly the endocannabinoid system. And what does the endocannabinoid system what is its function in our bodies? What the major cannabinoids of interest are, and then what is the evidence that we have for some of the clinical conditions that people say that cannabis is good for. I'll talk about practical use of cannabis, the routes of administration, how people are using it, and what we know of those different routes of administration. And then just briefly, we'll talk about some of the research that's being done at UCI. So this is the history. It started being used, first documented use was in China thousands and thousands of years ago, approximately 27,000 BC. And so it's been used for as long as as long as the history of humans have been around, for a lot of medical conditions. In China, it was used for autoimmune diseases, for pain, for inflammatory diseases. In Egypt, it was used for hemorrhoid pain, for eye pain like glaucoma, theoretically. And then it made its way to Europe and America. And in America, it was the most widely used drug between 1850 and 1942. So it was an actual part of our pharmacopoeia, which is basically the index of drugs that people can prescribe to patients. And it was the most widely popularized prescription drug. So what happened, and I'm not sure exactly what happened, but I think it was mainly the these claims that have been that were popularized at the time, demonizing the use of marijuana. So on the left, it's an image of somebody using marijuana and then basically progressing and starting to use heroin and becoming addicted to heroin. And it was labeled this gateway drug that opens the door to much worse drug use and addiction and even death. In America, though, within the last couple of decades, the rise in cannabis approval and use has definitely become popular. I think this is a little bit dated, this slide. It was in November 7th, 2018. But now there are over 33 states and the District of Columbia that have legalized cannabis for medicinal use, and 10 states, including the District of Columbia, that has legalized it for recreational use. And as I see the coming years, that I believe that most of this country is going to have have people use cannabis or legalize cannabis for some sort of use in the coming years. So I think this whole map is going to be green in the next 10 to 20 years because of the medical implications cannabis has. So in California, in 2016, we legalized it for recreational use. We were the first state to legalize it for medicinal use in, I believe, 1996. So that means everybody can use it, not just for medical conditions, but for recreational uses as well. Some of the terminology that's important to define is marijuana is actually the slang term for cannabis, and cannabis is actually the scientific name for it. And so I like to refer to cannabis by its proper scientific nomenclature. And then the subspecies are indica, sativa, ruderalis, which are the main subspecies that have been classified and characterized. Another term for cannabis that's commonly used is hemp. And hemp is the plant that has less than 0.3% THC content and was mainly produced for its fiber, but now recently people are realizing that cannabis has a lot of other potential cannabinoids within the plant that can be used, like CBD and other cannabinoids that can be potentially helpful in several different medical conditions. So they're really utilizing hemp now to produce these other cannabinoids that do not have THC in them. So the endocannabinoid system is the system that our body, or that this plant works on. It's similar and evolved in parallel to many other systems that we have, but one of them is the opioid system that also controls pain and also a lot of other bodily functions. It evolved over 600 million years ago. It's found in every animal species that has a vertebrae. And we do know that it evolved much further in the past than the plant. So the plant, we first find the plant about 25 million years ago. So we do know that our own bodies create naturally occurring cannabinoids that affect this system. The main components of the endocannabinoid system are these two receptors, CB1 and CB2, which stand for cannabinol receptor 1 and cannabinol receptor 2. They have many roles in our human function. They include regulating hunger, energy metabolism. They have a role in our brain and neuroplasticity. They have a role in pain, painful memory, suffering. They have a role in our blood vessels, so they can cause regulation of our blood pressure and our heart rate. It also has a role in our immune system, connective tissue repair, and also behavior. There are several different classifications of cannabinoids. So within the plant, we do know there's cannabinoids, and there's also something called terpenoids, which are what give cannabis its strong smell. The types of different cannabinoids are endocannabinoids, so the ones that are naturally occurring in our body. There are synthetic cannabinoids, so the cannabinoids that we make in the lab to mimic cannabinoids and affect those receptors. And the third type are phytocannabinoids, which are the ones that we find naturally in the plant. The two main ones that we have studied the most are THC and CBD, but there are over, actually it's not 80, but it's over 100 now that we have discovered. And we don't really know what all of these other minor cannabinoids do. There are several labs across the world that are trying to figure out what those cannabinoids do. The terpenoids are also something that people are studying as well. It was thought to just contain the smell of the plant, but people are realizing that potentially terpenoids also have an effect on pain and other medical conditions. So this is THC. It comes in a form called THCA, and when you heat it up, it becomes this active form of THC. It was discovered in 1964. It contains the psychoactive component of cannabis. It is believed to have an effect on these different types of pain, so neuropathic pain, chronic pain, or cancer pain, and I'll go into more detail later on in this lecture. But one of the metabolites, so THC is broken down in the liver, and it's broken down into a much more psychoactive form called 11-OH-THC. It is 4 times more psychoactive than regular THC, and that has an effect on the form of cannabis that you consume. So whether or not you smoke it or you eat it, it can affect you differently in terms of the psychoactive component that we're talking about here. CBD is cannabidiol. It was actually discovered before THC in 1940. It also has these two different forms, CBDA, which is its non-active form, and then it gets when you heat it up, it becomes its active form of CBD. It actually is not psychoactive. It blocks the formation of this very psychoactive metabolite of THC, and it also kind of blocks or modulates some of the unwanted side effects of THC. So some of the unwanted side effects of THC include anxiety, dysphoria, panic attacks, paranoia. And there is the question of whether or not this combination of these two improves the medicinal benefit of cannabis. And I think the jury is still out on that. So what is important in the product of cannabis that is being used is that we do know that there are these 3 main strains, indica, sativa, and ruderalis of cannabis. But the names really don't matter as much as the chemical profile. And when I say chemical profile, I mean what are those active components in the product that people are taking. So what is the ratio of CBD to THC? And then further research needs to be done on the more minor cannabinoids and what are those effects that are having. But that chemical profile gives whatever medicinal effect cannabis is going to have its characteristic. There are over 600 different species now because people have been hybridizing them, crossbreeding them, making all sorts of different types of cannabis with different chemical compositions. And I say 600 here, but I bet you that there are much more than that now. So so these are some of the claims that it makes. So what we see, on the streets or on the internet is that, well, CBD can reverse my aging, or I can be an Olympic athlete. So, but what is real? I don't know of any evidence that shows that these claims are actually true. What are the actual potential benefits of cannabis? And this is a list of the potential benefits of cannabis that actually have some scientific basis behind them. So it is a strong antiemetic. So people who get sick from chemotherapy, a synthetic cannabis called Marinol has been approved for chemotherapy-induced nausea and vomiting. There is strong evidence to show that it helps with nausea, vomiting, particularly due to chemotherapy. Anorexia is also another indication for it. So people who have AIDS and have anorexia, poor appetite from AIDS, people can take cannabis and it helps with their appetite. There's also strong evidence to show that it is a good anti-spastic agent in patients who have multiple sclerosis. It was recently FDA approved as an anti-epileptic or anticonvulsant for rare childhood forms of epilepsy called Dravet's syndrome. These last two here have not shown very strong evidence, mainly in the preclinical models, meaning that mainly in mouse models, is being shown to have some sort of neuroprotective effect and anti-tumor effect, which obviously further research needs to be done to prove those claims. But at least as a neuroprotective indication, it shows that in mouse models it potentially reduces the amyloid plaques in Alzheimer's disease. So its role in treating pain mainly is due to these two receptors again. The CB1 receptors are mainly located in the central nervous system, meaning they're located in the brain and the spinal cord and some in the peripheral nerves as well. The CB2 receptors are mainly located in the organs of immune function, so organs that cause inflammation or propagate inflammation or calm down inflammation. So the effect of these two can have a synergistic effect, so mainly reducing the painful impulses that are coming up through the spinal cord into the brain. And then the CB2 effect potentially has this anti-inflammatory effect that helps also with pain. So these are some of the landmark studies that have shown its effect for pain. On the top left is a study that shows that cannabis is good in painful HIV neuropathy. The top right was a study out of UC San Diego by Mark Wallace, who's a very famous cannabis researcher who has shown that it helps reduce hyperalgesia that's induced in a lab. It also has been shown to be good for neuropathic type pain and in some cases fibromyalgia. There is a caveat to these studies, though, is that yes, it did show these claims are true, but a lot of these studies were on patient populations that were very, very small. So 20 to 40 was the sample size for many of these studies. They didn't follow these patients for a very long amount of time, usually at most about a month. So we really don't know what the evidence is long term. So is it helpful for forever, or is it only helpful for a couple of weeks? And what happens if I'm taking this medication for weeks, months, and years? Do I develop tolerance? Do I develop other problems? And we just don't know because the research has not been done. this is also another schematic of patients who undergo orthopedic surgery. It just shows that more and more people are using cannabis to treat pain, particularly after having surgery. So of the people who had traumatic fractures, 20% or 21% used cannabis in the post-operative period to treat their pain. And of those people, 90%, about 90% said that it was helpful for their pain after surgery. But some of the things that we're really interested in is, how is it affecting all my other bodily functions? So does it affect my lungs? Is it affecting my heart? Does it affect my kidneys or liver? And a lot of the claims that for and against, some say that, so for people that are against cannabis, they say that it causes lung cancer. For people who say it's for cannabis, that they say it doesn't cause lung cancer. But this study shows pretty definitively, it was a very, very large study on 2,159 cannabis smokers, and they followed them for an extended period of time. And it showed that there was little to no evidence that people who smoked cannabis had an increased risk of lung cancer. So there was no link between lung cancer and cannabis smoking. What it does have an effect on the respiratory system is that it can cause you to have chronic bronchitis. So people who are smoking cannabis or vaporizing it, it's thought that the heat of the smoke causes irritation in the lungs, which can cause you to have chronic bronchitis. Usually this reverses itself if you stop smoking cannabis. So there's really the long-term risk of it isn't too bad, but it is bad if you have other lung issues, like if you're also a chronic smoker and have COPD, or if you have asthma. Cannabis can exacerbate some lung conditions. And what is its effect on the heart? So we also don't have very much evidence to show what the effect of cannabis smoking or cannabis consumption is on the heart. This was one study or one case report that showed that a person who had never smoked cannabis before and had heart disease that was not diagnosed, they didn't know that they had heart disease. They tried the cannabis and it caused them to have a heart attack. And the reason why is because THC, one of the main active component, obviously in cannabis that I've been talking about, really makes your blood vessels a lot bigger, especially if you're not used to cannabis. So the first time this person took cannabis, likely their blood vessels got really, really big, and that causes a drop in your blood pressure. When your blood pressure drops, your heart tries to compensate by that drop by beating faster. And this is what likely happened in this patient, is that their blood pressure dropped, their heart rate went up, and caused a heart attack because they didn't know that they had heart disease. But again, this is just one patient. It's hard to make any conclusive assumptions with just one patient case report. But it's something to proceed with the use of cannabis with caution. How does it affect our brain? So there have been a lot of studies that show that it affects our acute learning, memory, and attention span. So when you are affected by cannabis acutely, it can affect your learning, your memory, and your attention. Your short-term memory is usually worse, and usually, though, when you stop using cannabis, those learning and memory and attention deficits resolve. These are the common adverse effects, and this, when I say common adverse effects, this is mainly due to THC. So as you can see, it has a lot of adverse effects. It can make your eyes red, it can make you feel anxious, it can cause panic attacks, dry mouth, dizziness, make you not really feel good, and changes your visual perception. So what are the drug interactions that we know of? Again, this has not been very widely studied, and we definitely need more research to investigate the drug interactions of cannabis and other medications that people are taking. But we do know that THC affects the liver enzymes, and our liver metabolizes a lot of our drugs. So when we're either revving up some of the enzymes in our liver, that means that we are metabolizing some of the other medications that we're taking faster. CBD is a liver enzyme inhibitor, so that just means that it's slowing down some of the metabolism that the liver does, and so potentially can increase the level of medications that you're taking. Now, we haven't studied it very thoroughly. Again, these studies that I list here have been on a couple of patients, no more than 5 in each study. But as you can see, some have no effect, like Idinavir and Nalfinavir, which are HIV medications. THC and CBD use haven't shown any changes in the metabolism of those drugs. But other drugs like benzodiazepines, it can have an additive effect. So it can make you more sedated when you're combining it with benzodiazepines, sometimes alcohol, people who are on blood thinners. It may increase the level of warfarin, which is a common blood thinner people use. So the evidence of drug interactions and the studies that have been done to know whether or not THC is safe, or THC and CBD are safe for people taking these medications, we really don't have good evidence for. But we do know that they have an effect on other medications that we take. Some of the things that we definitely know that we should not be taking THC for are people who have a psychosis or a psychiatric illness that is not stable. There have been a lot of studies that have indicated that the use of THC can precipitate a psychotic episode. It can make your psychiatric illness worse. Sometimes can initiate schizophrenia. The relative contraindications, which mean that you should be very, very careful when you're taking or deciding to use a THC or CBD, is people who have severe cardiovascular disease, severe liver impairment or kidney disease, and people who are very, very sick. Also, people who have heart conditions like unstable arrhythmia or irregular heartbeat. But, you know, what a lot of people will tell you to is ask your doctor about medical marijuana. And the thing about asking your doctor about medical marijuana is, or it should be medical cannabis, but is that a lot of medical schools don't really teach us about cannabis. So a lot of doctors don't know very much about cannabis unless they have a particular interest in it. So I say this because if you ask your doctor about this, maybe they will pick up a book or look through the journals to find the evidence that or to find the answer that you're asking, or find the answer to the question that you're asking. And they will learn more, and then they can teach you guys about what is and isn't indicated in cannabis use. So the more practical things that I'll go over are, what are the administrations in different formulations, and what do we know about them? So on the left are the different routes of administration: inhalation, oral, sublingual, and then topical. Inhalation is definitely the most popular. Many people use cannabis by the inhalation route. And one of the good things about inhaling cannabis is that you feel an effect very, very quickly. Usually within 5 minutes, you'll feel whatever effect the cannabis product that you're taking will have on you. And if it's not having any effect, then you can just inhale some more. So it's very easily titratable or easily adjustable to the effect. If you're feeling good with the cannabis product, then you don't have to smoke anymore. The oral route is, well, one of the downsides to the inhalation route is that it lasts probably the shortest, or it does last the shortest out of all of these ways of taking cannabis, which can be good or bad. So if you're having a good effect from the cannabis, it only really will last you an hour or 2 hours. But if you're having a really bad effect from the cannabis that you've smoked, it will only last you an hour or 2 hours. The oral route of administration, one of the downsides is that the amount that's absorbed is really dependent on what is in your stomach. So if you've had a large meal, if you had a large fatty meal, or if you had a large carbohydrate-rich meal, or the keto diets, or protein-rich, then the amount that is absorbed through your stomach is altered, and it's either you can absorb a lot more or very little. If you don't have anything in your stomach, you'll absorb it differently as well. But usually the oral route can take up to half an hour, sometimes an hour and a half for it to start working. And that's where a lot of people that I have met and have tried cannabis get into trouble, because they'll try it and then not feel anything, and then they'll keep eating more of this cookie. And eventually, all of that THC and CBD will start having an effect on them, and some of them have had so much THC that they can't move, and then they go to the emergency room and feel like they have had a stroke, when really they're just really, really high. So that's one of the downsides to the oral route of administration. The effect also will last a very, very long time as well. It will last the longest out of all of these, and it can last up to anywhere between 4 hours to 8 hours. So if you're really it's really making you feel good and helping with whatever condition that you're taking it for, it can really last a long time. But if you're not feeling, or you're having some of these side effects, then it would be really bad to be experiencing that for 4 to 8 hours. So that's the good and the bad of the oral and inhalation. The other route of administration is sublingually, or through your mouth, or absorption through the mucosa of your mouth. That's kind of somewhere in between inhalation and oral. It usually takes about 15 minutes to 20 minutes, sometimes 30 minutes for you to feel the effect of the cannabis. And it has a moderate duration of action, so usually around 3 or 4 hours. And this is the way we usually tell patients to take cannabis, because it doesn't really affect your lungs. It has a very stable amount that gets absorbed. It's not really affected by what you eat, and it doesn't last eight hours. The other route of administration is the topical and route, which we really don't have very much research on the topical solutions of cannabis. There are people that say that the topical route of cannabis really doesn't produce any level of THC or CBD in your bloodstream, but the patients that I have encountered who have used topical CBD and THC have had very good effect from the topical formulation. So this is what you would maybe find in a cannabis dispensary. It's just an example of what you would look for. It should be tested by a lab in California. It should tell you a lot number and an expiration date, and it should tell you what is in the product that you're taking. So in this one, it's actually probably too small for everybody to read, but it says that the effective THC dose is 23% per gram of this product. It's got 2.4% CBD and 0.8 CBG, which again is another minor cannabinoid. But this product is mainly for recreational use because the THC content is very high and likely used for that psychogenic effect. These things on the right are state dependent, but it's just an indication of that these companies need to put on their product to show that it does have a cannabinoid in the product. Other than that, that's the main thing that those are used for. So take-home points for my patients are, I usually most of my patients are using it for pain, and they're not using it recreationally or to get high or have the psychogenic effect of THC. So I usually have them take a product that is higher in CBD than THC. Because, like I was saying before, the CBD can modulate those negative effects of THC. It's much better tolerated. It potentially has that synergistic effect with THC, so the anti-inflammatory effect of CBD and the possible reduction in the pain sensations with THC. The problem with some of these products, though, that are high in CBD and THC is that it's can be very expensive. And if it is cost prohibitive, I will just tell them to kind of scale back on the CBD to THC ratio because it is cheaper, although you may have some of those negative side effects. Usually I tell them to avoid edible because of the long duration of action, the variability of how much is absorbed through the stomach. If they are going to try it, I usually tell them to use it sublingually or inhaled. So these are some of the resources that you can use to look up more information about cannabis. UC San Diego has the Center for Medicinal Cannabis Research. The Health Effects of Cannabis and Cannabinoids. So that's a book that's put out every year or every 10 years by the National Academy of Sciences. They compile all of the research that's been done in the last 10 years and create recommendations or label what the strength of the research is for certain health conditions. It was last published in 2016, so the next edition will be in 2026. But it is a very good resource. It goes through a lot of different medical conditions that cannabis has been studied for and really gives you what the strength of the evidence for those medical conditions is. Other resources is the Canadian Consortium for the Investigation of Cannabinoids and also the District of Columbia's Department of Health. I'm sure there are a lot of other resources as well, but these are the ones that I usually use. So the research that we're doing at UCI, there's a wide variety of different things that we're studying. So we're looking at biomarkers to study pain and how it changes the pain sensation with the use of cannabis. We are looking at how we can use cannabis to help avoid using or reduce the amount of opioids people are using. We're studying it in the geriatric population, different pain populations as well. We're also looking at how cannabis affects anesthetic management in patients who are undergoing surgery, and how these anesthesiologists have to change their management of these patients. And that's it. This is time for questions. We also have a UCI Center for the Study of Cannabis as well, and I'm part of it. Okay.
Everybody. So can you stick around? if anybody has any. Yeah. So he'll be able to stick around for about 10 more minutes if you have any questions that we weren't able to get to. So thank you all for coming. I hope you all signed in, and we'll see you later.